Okay, so this is my identification from Durham College. So this video submission is about medication administration oral. So the medication that I'm going to give is Tylenol, which is for pain. So I'm just gonna take out my cue card to tell you the classification of this medication is analgesic. The side effect is nausea, vomiting, and constipation, and the onset is 30 to 45 minutes, and the peak is within 1 hour, and the duration is 4 to 6 hours. So now I'm just gonna put away my cue card. I'm going to give my health teaching to my patient before I give the medication. So now I'm going to review the medication policy according to the facility. So at this point, I am going to open the chart to have my signature. So I have to put the date is July 24, 2020, and my full name, Annabelle, and then my status SPN1, and my signature, and my initials. So after having my signature, I am going to compare the doctor's order to MAR. So I'll start with the first name. The patient's name is Sid Garland. Sid Garland, 344316. 344316 is the MRN. 11/08/1965. 11/08/1965. The allergy is penicillin and codeine. Penicillin and codeine. And the drug is acetaminophen, and then the dose is 650 milligrams. 650 milligram. The route is oral. The site is by mouth. And the frequency is every 6 hours. And the time in doctor's order is not yet been given. So in my MAR is 0600, so that means I have to give the medication first thing in the morning. And the special instruction is do not exceed 4 grams per day. So, and the time is 0600. In my MAR, I have to give first thing in the morning, and the medication is for pain. So now, after comparing the doctor's order sheet to the MAR, now I'm going to do my hand hygiene. Before that, I'm going to have my worksheet with me to compare in the patient's profile to make sure I have the right patient. So it's Sid Garland, and the allergy is penicillin and codeine, and the past medical history, who has type 2 diabetes, myocardial infarction for 2 years ago, peripheral neuropathy, coronary artery disease, asthma, and hypertension. So now I'm just gonna go to my hand hygiene again, and I'm just gonna take out the medication in the drawer to have I have the right medication, and I have the cup. I have to make sure that this is not expired, August 2025. So this is for pain medication. So I just have to compare the available to the MAR. So now this is my first check. Sid Garland, MRN 344316, 344316, 11/08/1965, 11/08/1965, and drug is acetaminophen. The dose is 650 milligram. In my available is 325 milligram, and the route is oral. It's the site is by mouth, and the frequency is every 6 hours, and the time is 0600, which means I have to give the medication first thing in the morning. And this medication is for pain. So now I'm going to have my second check right away, and to make sure that it's the right patient. Is Sid Garland. The MRN is 344-316, 344-316. The date of birth is 11/08/1965, 11/08/1965. The drug is acetaminophen. The dose is 650 milligram. In my available is 325 milligram, which I have to do a calculation, and the route is oral. The site is by mouth. The frequency is every 6 hours, and the time is 0600. I have to give the medication first thing in the morning, and the medication is for pain. So now I'm going to do my calculation. D is the formula, D over A multiplied by Q. So the available is 325, and the medication on my MAR is 650, which is the drug dose. And the available is 325 milligram multiplied by 1 tablet. So 650 divided by 325 times 1 is 2. So I have 2 tablets. So now I'm going to get open the medicine cup, the medicine will be in the lid for a sepsis procedure, and I'm going to transfer the medication in the cup. So now I'm going to cover it. Now I'm going to have my third check. So now I'm going to start with the first name and last name. Sid Garland, MRN 344316, 344316. The date of birth is 11/08/1965. The allergy, penicillin and codeine. The drug is acetaminophen. The dose is 650 milligram, and my available is 325 milligram, which means I have to do a recalculation, and the route is oral. The site is by mouth. The frequency is every 6 hours, and the time is 0600, which means I have to give the medication first thing in the morning, and this medication is for pain. So now I'm going to recalculate. I have the formula, D over A multiplied by Q. So the D is the dose, which is 650 milligram, and available is 325 milligram multiplied by 1 tab. So I have 650 divided by 325 times 1 equals 2 tabs. So now that I've done my recalculation, and I have the 2 tablets that I have, now I'm going to call the preceptor to check my work, and I have the correct medication. So now the preceptor is giving me the go to give the medication. Now I'm gonna go do hand hygiene and ready to enter the patient's room. So at this point, I'm going to introduce my name to the patient. Hi, my name is Annabelle. I'm a student nurse from Durham College. I'm here to give you your medication. Is that okay?
Okay.
Before that, I would like you to state your first name and last name, please.
Sid Garland.
Sid Garland. And your allergy, please.
Penicillin and codeine.
Your date of birth.
November 8, 1965.
Thank you. So you said that you have allergy in penicillin and codeine. So what happened if you have the reaction with the penicillin and codeine?
I get hives or rashes.
Thank you. So now I just gonna ask you if you need to void
No,
before I give the medication.
no, I don't
Are you
want.
are
I'm
you
okay.
in pain? You're okay? Are you in pain?
Oh, yes.
Alright, so um I just gonna do an environmental check. Is that okay?
Okay.
Okay. So I just gonna check your suction, your air, your oxygen, and your air, your suction and oxygen. Make sure that they are working properly, and your lighting in your room is okay. It's working properly, and I just gonna pull the drapes to for us to have a privacy, and I just gonna pull the rail up over here on this side to make sure that you are safe, and this side as well, and I'm gonna adjust the bed for my working height, and I just have to check your bed breaks, make sure they are on the four corners of the bed, and have to make sure that the bed is adjusted to my working height, and there's no clutter in the flooring for safety. So now I just gonna adjust your bed 90 degrees to make sure that you're comfortable. And now I'm going to tell you about the health teaching about this medication that I'm going to give you. So do not take more acetaminophen or take it more often than directed, okay? And avoid drinking alcohol. It may increase your risk of liver damage, okay?
Okay.
So now, could you please swallow the medication, please?
Okay.
Okay. And then here's your water.
Thank you.
So now I'm going to call my preceptor. So I have to make sure that I have to make sure also that you are able to swallow the medication. That you swallow properly, okay? And now I'm going to call I have to do hand hygiene, and I have to call the preceptor to sign the MAR, and I have to leave a space for the preceptor to co-sign for me, and the date and the time, July 23, 2020, and the time, so 12 o'clock. So my preceptor will sign in this area. So now that I've done the signature on the MAR, and the preceptor will sign it for me in this spot here, and now I'm going to process the patient. I'll be back to make sure that there's no reaction of the medication. So that concludes the medication administration oral.
Okay. Thank you, Annabelle.